indication and contraindication of warfarin. Warfarin, with brand names such as Coumadin and Gentabin, is a prescription medication used to prevent harmful blood clots from forming or growing larger. Warfarin acts as a vitamin K antagonist. Clotting occurs by platelet activation and generation of thrombin by coagulation factors such as factor 2, 7, 9, and 10. Vitamin K is essential in the production of these factors. Therefore, warfarin antagonizes the effect of vitamin K and inhibit clotting formation. Indication is a condition which makes a particular treatment or procedure advisable. So, what are the indications of warfarin? The first indication is the prevention and treatment of venous thrombosis and pulmonary embolism. Venous thrombosis is a blood clot that forms within a vein. Pulmonary embolism occurs when the blood clot breaks and blocks the artery of lungs. Warfarin will help to prevent blood clot deposition in the vein or lungs. Next is the prevention and treatment of thromboembolic complications associated with atrial fibrillation and cardiac valve replacement. Atrial fibrillation is also known as irregular heart rhythm. Patients with atrial fibrillation have decreased in efficiency to pump out blood, resulting in low blood flow. The blood starts to pool in the heart, causing formation of blood clots and may lead to further complications such as stroke, which is the formation of clot in the brain. Cardiac valve replacement may induce blood clot formation and lead to prostatic valve thrombosis, which is a rare but serious complication of valve replacement. Next is reduction in the risk of death due to recurrent myocardial infarction and thromboembolic events. Myocardial infarction is also known as heart attack. It is permanent damage to the heart muscle. Heart attack can occur when there is a blockage of blood vessel that supplies the heart by blood clot formation. If a blood clot totally blocks the artery, the heart muscle becomes stuffed for oxygen. Within a short time, death of heart muscle cells occurs, causing permanent damage. This is a heart attack. Warfarin won't dissolve a blood clot. However, it prevents other clots from forming or growing.
Contraindication of warfarin. Contraindication is a specific situation in which a drug should not be used because it may be harmful to the person. So what are the contraindications of warfarin? Pregnancy. Warfarin is contraindicated in pregnancy as it passes through the placental barrier and may cause bleeding in the fetus, and also commonly associated with spontaneous abortion, abnormal bond, stillbirth, and preterm birth, neonatal death, and fetal warfarin syndrome. Fetal warfarin syndrome is the disorder of embryo resulting in a low birth weight, mental retardation, and bone malformation. Warfarin can be given to breastfeeding mother because only a small amount of warfarin can cross the breast milk, and warfarin can also be given to pregnant women with mechanical heart valve. Severe liver or kidney disease. Patients with liver disease have reduced liver function and may impair synthesis of coagulation factors, leading to increased warfarin sensitivity. Patients with kidney disease or renal impairment are at an increased risk for bleeding problems due to excessive anticoagulation and hematuria. Uncontrolled bleeding. Warfarin can increase the risk of bleeding and prolong the bleeding in conditions such as active ulceration. Uncontrolled hypertension. Patients with hypertension exceeding 180 over 120 mm mercury are at an increased risk for cerebral hemorrhage and stroke. Lastly, patients undergoing surgery. Since warfarin can increase bleeding, patients need to withhold warfarin for 3 to 5 days to avoid massive blood loss during major surgery, especially spinal tap, eye surgery, brain surgery. Warfarin should also be withheld 1 to 2 weeks before in recent trauma such as accident.